Welcome, everybody. This is our weekly briefing from Indiana University, IU Health, the city of Bloomington and Monroe County on the efforts to combat the COVID-19 pandemic. I am Chuck Carney, Director of Media Relations for Indiana University. We'll open it up to your questions as usual here in a moment. After we have some opening remarks, we will start with Mayor John Hamilton.
Thanks so much, everybody. Good to be with you again. I'll start just by reminding folks that the city 15 person limit for private social gatherings remains. We continue to enforce that. Calls every week to help make sure we're all complying with that, despite any changes in the governor's state order. And I'll come back to that in a minute, but that 15-person private social gathering limit remains, as do the countywide other limits, 100 and 150 for indoor and outdoor commercial gatherings as well, always requiring masking and physical distancing whenever possible and feasible, with the continued restrictions on restaurants and bars for in-person must be seated only service. We continue to monitor that, and that has been very helpful. I'll just note, I'm sure you'll hear from IU, but it's so important, and it was such good news to see a second week in a row from the very detailed IU dashboard and reporting that they'd seen positive movement in basically all categories. I'm crossing my fingers for 3 weeks in a row. That Wednesday morning data release is so important, so we appreciate the collaboration on that. I'll note as well, we had a very good meeting this week with the city and Indiana University talking about off-campus students or those who may not be available for the on-campus Ashton facility isolation or quarantining. And I just want to thank IU for very good collaboration as we think about if there are circumstances where an off-campus student has difficulty either physically or in other way, isolating and quarantining as they should be, to work together to try to do all that we can on campus or off campus to help make sure we don't get further community spread from somebody who either has a sickness or needs to quarantine. So I want to thank on that. I will also look forward to collaborating with the county on Halloween. I think that was mentioned briefly last week. We don't have a strategy yet. CDC, Center for Disease Control, put out some guidelines, which we appreciate lately. And I look forward to working with the county health department and others, because I think it will be helpful if we have a consistent message about the best safe way to celebrate a very popular holiday. But we want to make sure we do it in the right way, and we'll be talking about that in the weeks ahead, I'm sure. I'll just close by saying I am disappointed that the governor has taken the steps he did to move into stage 5, to indicate the plan to end the mask requirement. I don't think the science suggests that that is the right move at this point. I'm concerned about that, and I'm worried that that's too fast, too soon, and that it's not really driven by the data that need to drive that decision. I will again thank the governor for allowing local jurisdictions to do what we think is right for our people. Of course, we get people from all over the state who come here. It's really important that we communicate that the rules here are what they are here, and we set those to protect each other and our future. So I'm disappointed in that change. We want to keep doing what we're doing. The risk-reward ratio is very good still for masking, and we should be continuing that. And I expect and hope we will continue that locally, as well as some of these controls against spreader events. So I'll take questions on that. And thanks again for everybody's attention and good works to help keep the city safe.
Okay, thank you, Mayor. We'll next go to Monroe County Health Department Administrator Penny Caudle.
Good afternoon. Thanks again, Chuck, for hosting us. And thanks for the good segue in there, Mayor. Appreciate that. For anyone watching the data and the State Health Department dashboard, they know that we are seeing some improvements in what's happening. Today, our positivity rate was 3.5%. However, if you're looking at our per capita rate, that is still in the orange if you're paying attention to that. color-coded map that the state has started using. I would say that probably today we're more yellow than we are orange, but we'll see what happens next week. And either way, whether we are in yellow or orange, we know that we still have to be pretty cautious. And we want to make sure that any improvements that we're seeing, that they're steady improvements. So before we really move forward. So we do need to maintain, this is a time to maintain the things that we're doing because we're seeing them work. We're seeing masks help and make a difference. We're seeing that physical distancing help and make a difference. So as the mayor mentioned, Governor Holcomb did issue an executive order yesterday, moving Indiana to stage 5. Monroe County will remain cautious and yet move forward a little bit with that caution. So the governor made his announcement on, actually I said yesterday, he issued it yesterday, I believe. He made the announcement on Wednesday. I will remind people that local health departments do not get any upfront early notice when those changes are coming. We heard about it while on another call, got notice that he had made that announcement. So at that time, we again started looking at what the changes in his order, his executive order might be and how that might affect ours. Yesterday, on Thursday, we were able to actually review the Back on Track and look at the executive order. And after reviewing it, we did determine that at this time, we don't need to change our current regulations or health order. We will continue to monitor that and determine if we need to make changes. However, with that, I do want to make some clarifications because I know there will be questions about some of those things. As the mayor said, we still have locally lower limits on social gatherings. In the county, it's 50. In the city, it's 15. For commercial events or venues, it's 100 if it's indoors, it's 150 if it's outdoors. We do still have exemption process. So if somebody is having an event and they need to have an exemption for that, they can put that request in. Does require that they have a lot of safety measures in there, that they have someone taking responsibility for the event and monitoring that hand sanitizer or hand washing is occurring, that people are wearing their masks, socially distancing, those kinds of things. So I just want to remind people about those local limits, regardless of what the state limits are. Masks remain and physical distancing are still a part of what's expected in our community. There's clear evidence that these things work, and I think that they will stay in place locally until there's clear evidence that we're in a good place to lighten those up. The other thing that we've already been asked about is restaurants and bars. And I want to talk about that just for a minute. They're really, even though the governor's order took away the percent capacity, that percentage was put in there to really allow for the distancing that needs to happen between patrons in those establishments. So taking that away, that, when you say 100% capacity now, it's a new capacity. It is not what it was a year ago. So to reiterate what is in our local order, table service is required. People need to be seated. And they need to remain seated. And if they're up going to the restroom or something like that, then they need to have their mask on. There is no bar top service. Groups of people must be 6 feet apart. And that is also in the governor's order, and it's not table to table, it is person to person. So a group of people at one table needs to be 6 feet away from the other group of people at another table. We remain, ours remains at 10-person limit per table, and then the air ventilation to be at maximum or at 6 air changes per hour. So the governor's order does require that people be seated in bar areas, that people must be 6 feet apart. And again, people to people, not table to table. So I will say it again, while the percentage went away from the order, that was really just there because when you start putting that distance in, there's no way that you're going to have your old capacity. So our current order remains. We will continue to monitor it and to assess the situation, see if there are challenges, things that come up that we need to deal with. The Board of Health does have a meeting scheduled October 6th. So the health officer and the board will discuss the regulations and any changes that may need to be made at that time. If you have questions, I would urge you to go to our website. You can look at our current health regulations, and you can go to the state health department or the governor's website to look at the executive order that he released. The next thing that I would talk about is the mayor mentioned is Halloween and holidays, and the CDC did release some guidance on high-risk activities, and the county and the city and other partners are discussing ways that we might be able to offer some alternatives. But primarily, we want people to be aware of options and how they can do Halloween or any holiday gathering that they're having more safely. When it comes to Halloween, and I know that people are trying to prepare for that now, we're getting lots of questions. High-risk activities are considered that traditional trick-or-treating, going from house to house. Maybe it's people you know or don't know. You don't know what precautions they're taking. Everybody's sticking their hand in that candy dish. Groups of people may end up congregating, and so those are things that are less safe. You may be able to do trick-or-treating if you can keep people separated, if you pre-bag candy and put it out for people, kind of a grab and go kind of thing is considered a more moderate activity. Things that are lower would be sort of outdoor pumpkin carving contests or scavenger hunts, those kinds of things. So we are working on putting some things together as a community that may offer some different alternatives to people, but certainly now's the time to think about how you want to keep your family, your children safe during Halloween and all the fun that comes along with that. We have had some questions. We've had some recent complaints come in about off-campus house parties exceeding city gathering limits. And so I just want to remind people, and Mayor Hamilton, you might want to talk about this in a minute, but call the non-emergency line to the city BPD. Calling our complaint line isn't going to get you anywhere, any help in that immediate time. What it may do is if we know that there's a police report or something, then we may be able to follow up and deal with that in collaboration with the city or the university after the fact. But if you are needing something done in that interim time period, our hotline is not a hotline to call. So we will work with the city if we need to on different actions around that. We continue to work with our schools and the university and all of our community partners on all of these various responses to COVID-19, and we look forward to continuing those partnerships.
Okay, thanks, Penny. We'll next go to Allison Moore.
Thanks, Chuck, and thanks to the media that continue to come every Friday and listen to this press call and have released some wonderful information on our behalf, and we are very thankful and grateful for your continued efforts. Our September blood drive is full. I was a little nervous because normally was usually in the past they have filled rather quickly. And so we're excited, and I want to thank the public and all those that were able to get signed up for the September blood drive. And because it's full, I'm going to go ahead and start announcing the October date is October 14th. It will be held at the Monroe County Convention Center. They have wonderful staff that have been so wonderful to work with and have collaborated with the Red Cross, and we're forever grateful for that. You can schedule an appointment for that blood drive by going to the redcross.org website and selecting the October 14th date and then selecting your time. We also continue to have masks available for those that need them at various places throughout the community, and you can register, or you can register for an appointment to pick up those supplies if needed. Those phone numbers to make those appointments are also on our county website, as well as the locations where you can pick those masks up. And I also just want to mention again our Monroe County Alert system. It's a mass notification system where we send out information in regards to health orders and weather-related events. And if you have not signed up for that system, you can also do so on the Monroe County website at co.monroe.in.us. And that's all I have, Chuck. Thank you so much.
All right. Let's next go to Monroe County Commissioner Lee Jones, who joins us this week.
Thank you. This is my first time here. I'm delighted to see all of you. Commissioner Thomas is not available today, so I'm filling in for her. And she gave me some ideas about what I should talk about. First of all, CARES money is available right now for Monroe County businesses and nonprofits. And this is for expenses that are not payroll expenses, but are COVID related and that are not covered by other loans or grants. The county is also making some township assistance available. The number of people who are finding themselves homeless or unable to pay their utility bills can apply to their township trustee, and there's one, everyone in the county has a township trustee, for assistance with those things. The commissioners in the council have worked together to make a significant amount of extra money available to the trustees so they can help people out. And I would like to remind anyone who's interested in participating in our upcoming election that you must register by October 5th. Early voting starts on October 6th. And if you're planning on using a mail-in ballot, please apply right away and send it in as quickly as you can. If you want more information about all of this, you can visit indianavotes.com or monroecountyvoters.us. And let's see. Oh, it's a new project that the county, actually it's the Monroe County Women's Commission is putting together, is a healthy eating project. They have arranged for it. This was originally thought of before COVID and was going to be quite a bit more extensive, but it's had to be changed quite a bit. And they actually got a grant to do it. On the 29th of September, there will be an in-person session for 10 people at the Banneker Center starting at 6 p.m. And there's a local chef who will be talking about healthy eating and teaching the kinds of cooking techniques that are needed to provide your own healthy food. This is a kind of exciting new endeavor, and it is going to be videotaped. We don't yet have all of the information about that, but if you are interested and would like more information, please contact the county treasurer, Jessa McClellan. You can email her at the county. And I believe that is all that I have for right now. Thank you.
Okay. Well, we will next go to Indiana University and Kirk White.
Hey, good afternoon, everybody. I appreciate all the good updates today. It's really been good news for the community. At Indiana University, our downward trend continues, as the mayor mentioned. We're very encouraged by that as well. Overall, in our residence halls, the positivity rate went from 2.4 to 2.2%. In the Greek housing organizations, from 14.6 to 3.3%, and off campus 2.9 to 1.8. Boy, we want to continue this positive trend, and if we can just hold on to this by remaining vigilant, I think we're going to continue to stay in good shape for the semester. I just remind everybody, and I'll repost here where the dashboard is. That gets updated every Wednesday. And you can get a pretty good look at the numbers that we've compiled from week to week and see where we are. Our mitigation testing that's reported on Wednesday will continue along its path of success. We still have 2 sites operating on the campus. The way that works is students receive an email and are told to pick an appointment time, and then they show up during the week and get tested. And we track all of that. We're continuing that path of about 10,000 tests a week at the moment. Once we get our own lab set up here in November, we expect to increase that significantly because we'll be able to do it faster and more efficiently by keeping it all here in Bloomington. The contact tracing piece of it, where our team of 40 staff members are calling those who have tested positive, finding out about their close contacts, and then calling the close contacts and getting them in either quarantine or isolation, depending. That's continuing to work very well. And they were really busy a few weeks ago when our numbers were higher, but they're doing very well, and I think making good progress. And it's all part of how we're keeping things under control at the moment. But the message, of course, as I started to talk about, is remaining vigilant, not getting that feeling that, well, we're doing so well we can let our guard down. We've got to stay on task. We've got to continue practicing the safe protocols, and there just isn't any more I can say about that we haven't said already, except that as the fall continues and we start to see influenza as a problem, it's going to kind of double the vigilance that we need. And speaking of that, our planning continues for the flu clinics that we will have on campus to vaccinate a large percentage of the campus. We're also encouraging people to use their private sector providers, but we'll have it available for everybody on campus who wants a flu shot. We'll have points of distribution set up probably starting in mid-October to get those out. We're also starting to plan for that winter intersession that starts the week before Thanksgiving and runs through February 7th. We expect the campus population to shrink considerably. There will still be some people that will be here, but overall, there will be no in-person classes during that time. So we are encouraging students to consider taking classes online at that time, and then we'll resume face-to-face classes again on February 7th, of course, again with the mix of distance education as well. So that's our update from IU this week. Thanks.
Okay, let's go to IU Health and Brian Shockney.
Good afternoon, everyone. I just want to make sure that as you are driving and walking about the community, you are seeing that the leaves are beginning to change. And it is that time where the southern Indiana is gorgeous and it lifts our spirits and our hearts. So get out there, look at the leaves, spend the next week or two really enjoying the heart of southern Indiana. Our update for our data, we continue to maintain, we continue to see the slight declines that we're seeing across the region and everywhere else. So we are very proud of that. Flu shots, as Kurt mentioned, we are providing flu vaccine in our clinics. We are doing flu shot clinics and many other locations across southern Indiana, and encourage everyone to get that flu shot so that we can avoid any issues in the future. I do want to just lastly say, why is our community safer than others? As we continue to monitor the spread and prevalence of COVID, our IU Health communities across the state have been looking to this region and to this community. Why are they looking to this community? Because we've been able to maintain and stay stable in our infection rates. We need to not go outside of Indiana to see how we're winning this battle against COVID-19. Indiana University, Bloomington, the Bloomington community, Monroe County, we're all leading the way and ensuring the best decisions are made to protect each person and ensure that their health and their life is taken care of. While Indiana's governor continually moved through the Back on Track Indiana Recovery Plan, we used the best minds and leaders to stay the course in several areas which differed from the Indiana plan. And now we continue to see it was and is the right decision. This battle's far from over. While there is promise, there is no vaccine, and flu season is upon us. IU Health thanks you, the community, all the people who are on this call for your personal and professional sacrifices that have been required to avoid needless spread of this virus and its devastating effects. Staying the course by trusting your local health department and elected officials' decisions will continue to ensure our communities are safe and healthy. Please continue to wear your mask, physically distance, and practice all of the important methods we have been discussing over the past 6 months. It will continue to save lives. Thank you.
Okay, we will go ahead and get into questions. Our first question comes from Dave Askins at the B Square Beacon, and this is for IU. Bloomington Transit ridership numbers are way down even after the arrival of students back in town. Does the IU campus bus system have any ridership numbers that it can share compared to last year?
I don't have those numbers handy, but I can get them. I imagine we've been compiling those. I'm sure they're down because our plan was to, as we de-densified our physical facilities, we see the buses the same way. And two things really. One is, of course, there's just fewer people on campus because there aren't as many in-person classes. Only 40% of them have an in-person component. So you just have fewer people moving around. And second, we knew that the normal capacity of the buses was going to be too dense for us to maintain the kind of distances to be safe. So we put a policy in place that we dropped the capacity of the buses 50%. So I'm sure they're down, but I don't have exact numbers.
Okay, still waiting on another question, so I will do an early vamp. This is the earliest I think I've ever done a vamp on this. You guys have answered all the questions already, apparently, but I'm sure that there are some, so I will wait for another one to come in. Meantime, in the chat, we have mentioned Kirk put up the fall2020.iu.edu site where the dashboard is available, and you can look up Bloomington and any IU campus there for those results. And then the violations phone number, Mayor Hamilton has shared, 812-349-4477. Mayor Hamilton, I will go to you. Penny alluded to, you might want to elaborate a bit on what she was talking about reporting there. Would you like to add any more to what she said?
Sure, happy to. And also, I just was checking on that bus data, and I'm careful because often Dave Askins knows the data better than I do. But with risk of that, the Bloomington Transit is running about 20 to 25% of normal. That means 75 to 80% down, I believe, in terms of total ridership. And IU is even lower than that, according to Lou May from the transit system. So, you know, buses are, the transit systems are definitely having a very major change in how they operate. And we did get, it is important to remember, we did get federal money to support the transit system, which is very helpful. And thank you. Yeah, Penny Caudle mentioned we continue to welcome and get reports. They actually have declined somewhat week to week in terms of potential violations of those private social gatherings. I used the number myself, as I put in the chat, as I've done some walks around my neighborhood to just have people check in on events. And as Ms. Caudle said, if you're doing it particularly off hours, but it's not bad to do it anytime, you can call the non-emergency police number. You can always call my office if it's during the day too, but I would recommend just calling this non-emergency police number of 812-349-4477, which is answered 24/7. It's not the 911, so it's not putting you into the dispatch system, but they can send either IU police or Bloomington police to a location, and we do encourage that. Look, these are the reason we put this limit in place was to try to stop super spreader events where you could have a big number of people with one sick person, and all of a sudden you got 40 or 50 people or more who are potentially infected and can spread in the next day or two. So we do take it very seriously. We appreciate the notices. Again, for people who see more than 15 people who are gathered, or even smaller numbers, though it gets tricky, but if smaller numbers are not a household member, as they should be masked and distanced as well. And again, that's 812-349-4477. Thanks.
Okay, another question from Dave Askins. Have you, and this is for any and all, have you been able to identify at least some jobs that could be done remotely even after pandemic conditions are over? Obviously not pothole patching, but it seems like maybe a lot of positions in all aspects of government and the university could be made completely remote or maybe require someone to come in once a week. And he adds that this seems like something that could be pursued in the context of climate change, et cetera. Is it too soon to start thinking along these lines? Who wants to jump in on that one?
This is Brian Shockney. I'll take that from IU Health's perspective. On any given day, we have a minimum of 9,000 of our 34,000 team members working from home. We have begun that reevaluation specifically here in the South Central region as we begin to plan for moving away from our campus into an administrative office building, as well as the facility behind me in my picture. And so we do have several departments that we are now planning. January 1st, let me say, January 1st is when we are reevaluating if people will come back to work of those positions. But we have made some decisions over the past couple months of entire departments and individuals who will work continuously remotely from home from here forward. And so that has allowed us to begin engaging a real estate consultant to talk about decreasing some of our footprint. So it does reduce the number of people driving. It does reduce use of energy. And so we are doing that now and looking through that. By January 1st, we will know who all will permanently be working from home. And then we are creating what we're calling touchdown space for those who need to come in 2 days, 3 days a week periodically and do not need permanent office space. So this has caused us to really reflect on how we do our work and where we do our work. And we're taking advantage of this opportunity to reduce costs in healthcare.
Yeah, Mayor Hamilton?
Yeah, I'd be happy to. I mean, I'm sure everybody can respond to this. Absolutely, it's not too early to be thinking about it. We're all thinking about it. I'm confident. City of Bloomington, you know, we've had our personnel have been on the job continuously every day since March, but many have worked from home, and we continue to find that is a feasible option in the future. Some of us are old enough, I guess, to remember that the predictions of remote working and telecommuting often seemed slower to come than was predicted. But this crisis has, man, it totally accelerated that review. And so many jobs and so many aspects of jobs have changed. I have no doubt we have a continuity of city government committee that continues to meet and is looking at this. Just as an example, I'm sure it's true in the county too. We find participation in public meetings has evolved and changed. We have more people attending some of our meetings, significantly more people attending when they can do it remotely. And there's really no reason generally to think, why wouldn't we let that continue when it can be done feasibly? So for council meetings and public hearings and public input meetings, we'll continue that. workforce for sure. And I'll just close by saying, you know, as a city too, in terms of economic development, we're very aware of the fact and actively looking at the fact that companies now all around the country and the world are changing their employment patterns. And you can work for a lot of companies now that you couldn't a year or two ago while living in Bloomington. So that really changes the quality of life, opportunities for positive employment engagement. Just an example, the Mill is running a code school to train coders. We had 140 applicants for 30 positions or so, and a lot of them underemployed, underrepresented individuals in coding. Those jobs are going to be available. They'll be looking at jobs all over the country and world. So governments need to do that as well. And as IU Health, and I'm sure IU2 and county are all looking at that.
Yeah, Chuck, I'd say that at the university, just like at IU Health and county and city government, we've got a large number of employees that are student and externally facing that are going to need to continue to interact as we have for many years now. But we've started a trend really that's changed a lot of. We've moved a lot online. For example, you don't need to personally go someplace to register for classes now or pay your bills or any of that. That's all been automated. I think what we'll see is certainly a reevaluation, as everybody's mentioned, about the kinds of space and how it's utilized. And I think two other things. First, I think we'll see a much, now that people have figured out how to do this and started to be comfortable with it. Yesterday, I had 8 Zoom meetings as an example, and I think there's a lot of others that are at that or more. So I've become comfortable with it, and my colleagues have too, both in and outside of the university. But I think there will be times where we can say it's more efficient to not be driving into campus every day, certainly on those days where the weather causes it, where we really didn't have the tools in place at people's homes to continue operations when we had a bad weather day in the winter. We can do that now. And so I think that'll be an easy thing. You can put in a full day of work or more by just being at home, because we've got the system set up to do it now and the bandwidth and that sort of thing. But finally, I think we shouldn't discount the need for interpersonal interaction. And that's what we're missing in all this. That's why we're seeing people have mental health issues, because it's not natural to stare at a screen 8 or 10 hours a day with no other interaction and not get outside and that sort of thing. So there's a balance that we're going to have to meet here. But I think there's some good adaptation that's being discussed now to do that.
Yeah, Lee.
The county also has a continuing of operations plan, and every department has developed their own. At this time, county actual in-person meetings in the county are by appointment only, and we still have all employees who are able to remotely work are doing so. We're also using some very flexible work hours to allow people to come in at different times so that it never gets too crowded at one time. We will be reevaluating this regularly, but another thing that plays into it, of course, is what the schools end up doing, because that has a big effect on childcare. And many of our employees have young kids in school and are doing a lot of their education online at home. And so one of the parents or someone needs to be able to keep an eye on them. So a lot of our employees are finding that this kind of flexibility is really necessary for them right now. We also are seeing greatly increased attendance at our county meetings. And right at the moment, since no one is using the Nat U Hill meeting room, it's being revamped quite a bit. And a lot is being done with the sound system and video system and all of that. And they are also setting it up so that if we do go back to in-person meetings, we will be able to continue to do the Zoom meetings so that the public can more easily participate.
And one follow-up to that from the B Square Beacon from Mayor Hamilton. This obviously would have some implications potentially for local income tax revenue. And he asks, when the legislature starts in its 2021 session, will the city be advocating for reevaluating whether income tax still gets paid based on where you live instead of where the job is?
Well, I got a big list that I'd like the legislature to think about in 2021, but including, of course, there are a lot of places around the country that have what are affectionately called commuter taxes, where those who work in a metropolitan area help support taxes there rather than just being on where they live. And we certainly will be advocating to give more flexibility to local governments for a place like Bloomington to have do our own income tax rather than make it countywide. But I think the question gets to a bigger point, which is that it is relevant right now, whether you work from home or whether you drive into IU Health or IU or anywhere else, wherever you work physically, you pay your income taxes based on where you live. So that actually wouldn't change a lot, I don't think, as I think about it. If you work from home instead of an office location or plant location, a facility location, but it does remind us. I just heard the other day, for example, that I believe, and I don't quote me, but that the number of people getting effectively unemployment insurance through the gig economy, through the special federal legislation, opening up the unemployment insurance to people not in the traditional unemployment insurance, was actually larger people getting the special gig unemployment insurance than the regular unemployment insurance, reminding us that the economy is very different. And we really do have to think about the social safety net ways that we support workers and families, as well as the way the tax structure works to make sure we do fund the essential operations of government. So I kind of doubt whether the legislature would dig into that. And I'm just reading your comment here. It does make it easier to live outside the county and still work a job in Bloomington. That's true if employers do that. If vice versa, people can live in Bloomington and work anywhere else in the county or outside the county or outside the state or country. So I don't know how on balance that would shift things, but we'll keep an eye on it.
Okay. All right. Well, that is going to do it for this week. We will plan to be back next week at 1:15 for our next update. Thanks, everybody, for joining us this week.